Welcome back. Well, that's what we're focusing on now, and we're joined by Adenike Adebiyi, who is an epidemiologist. Thank you for coming on this morning.
You're welcome.
We're looking at that meeting. It arose from concerns that have been raised, but you've been observing scenarios from a distance. You've seen how we're tackling this. From your perspective, do you think that we're taking the right steps, or what else should we be doing?
Thank you for asking me this question. I've been following these stories and I've actually been very interested in it. What happens is a lot of the media and the publication that I've seen regarding this issue has been on microscopic level. And when you have a public health issue of this magnitude, you have to look at it from a macro area. You know, I've seen a lot of doctors and a lot of physicians coming on programs and, you know, giving specification on what should be done and how it should be done. But the problem is, in the United States or in the UK, when you have crisis of this level in public health, there are specialties that actually look into it. And these are people who are specialized in looking into problems in a community focus, as opposed to a patient in a hospital, as opposed to just an individual. There are specialties that are created for people who look into a community problem, who look into population problem. You know, all these doctors, yeah, they're very good doctors, and all these programs that they've been discussing are actually good ones. But you have to include people who are specialized in looking into this problem from a population focus. Because this is not just one person in the hospital now. We are talking about communities. And this is where an epidemiology, or people who are focused in epidemiology, comes in. They look into community problems, and there are surveillance programs that are in place by the federal government and on the local levels. But there are people who actually, this is all they do. They manage communities, populations, and look into issues from a population perspective, from a community perspective, as opposed to a doctor. Like if you and I were sick now, you go to the hospital, you know, you'll be seen by a clinician, you know, they diagnose your problem. But there are people who actually diagnose the community, who diagnose population. And this is their specialty. And all they do is look into the problems from a population focus, from a community focus. All the surveillances, yes, when you have that kind of crisis, there are programs in place. But what I'm trying to say, there are people that's just their specialty to do.
All right, we'll take a look at this a little further in terms of taking it from, you say, then to diagnose the community now, not just the individual, but it does start with the individual. We'll let you talk to us about that when we return in a moment. Join us again. Welcome back, and focusing on what we need to do a little differently to ensure we curb or tackle meningitis. You were talking about our approach, but at the moment, you know, we've got those who are going about vaccinating people to ensure that it doesn't spread any further. We've got doctors, I think even public health practitioners have also spoken to us about what they are doing. So, following up from where you left off in terms of diagnosing a community and not just an individual, doesn't all of this approach fit into what you're describing?
Yes, it does, and I believe the doctors are actually doing a significant good for this country. I'm not condemning the approach at all, but I'm just saying that in cutting costs in healthcare, in cutting costs and in managing health care, there are approaches that are in place that have been practiced successfully in areas where the cost is an issue, and they have been effective. I mean, I've had a lot of discussion regarding surveillance. I've had a lot of discussion regarding vaccination. I've had a lot of discussion regarding prevention, which are all things that public health people take into account before you can successfully run a program.
So what do we do to get results with a lot less cost?
Well, we have to try and tap into the resources that we have. You know, you don't wait till people run to the hospitals and, you know, impose more pressure on the doctors. You know, you have 50 people visiting the hospital at a time. When you could use public health officers, you know, nurses, social workers, you have all these people that are parts of the healthcare system. and they should be used instead of putting a lot of the pressure and burden on physicians, having people in crisis, 50 people visiting the doctor at a time.
What do you think the governors are doing now? What would you advise the governors now that they've met, the northern governors that is, to try to contain this epidemic? What should they do?
I think right now that the crisis is right there. I think there has been some containment. What I'm thinking of is, in future, how do we prevent such attacks again? How do we prevent such things from happening in communities? And that's where we have epidemiology and people who are trained in public health come in to put in programs and to make the surveillance system more effective. 1-2 cases are enough to trigger the surveillance system, as opposed to having 200 people who died actually. And those are the dead people, and there are still people who might even die. You know, kids who never had the chance to leave. So 1 or 2 is actually too many. If we have the surveillance and we have the right people in place to monitor the process.
All right, Adenike, I know you have a lot more to say.
Yes,
but
I do.
This is what we have to echo today at the program. She's an epidemiologist, and we appreciate your coming on this one. But we'll be in touch and see how we could explore this a little further.
Thank you for having me.
Thank you for coming on too. But just before we go, we've got time for one more thing. There you go. We have lots of people who lose money on a regular basis, and they just say it's history. But this man who you see here is a man who returned $10,000 at UBA. He was rewarded by the management of the bank. So good people still out there, and so that's why he's being celebrated. And you can imagine $10,000. He could have decided to help himself, but the good man in him thought otherwise, and that's shown strong. So, well done.
And he got that handshake from Tony Elumelu, which is brilliant. So you never know where a good work will get you to.
So that's it today. Thank you for watching. I'm Chamberlain Uso.
And I'm Gimba Omar.
Thank you.